To begin with, let's examine the extent of the pelvic cavity. Anteriorly here, we have the pubic symphysis, and this is the superior ramus of the pubis, inferior ramus of the pubis, and the body of the pubis. Posteriorly is the sacrum. You can see the sacrum and the coccyx here. Here is the level of the superior pelvic aperture, and this is the superior boundary of the true pelvis or obstetric pelvis or the pelvis minor. And inferiorly, the pelvis is separated from the perineum by the pelvic diaphragm. So this is the pelvic diaphragm, which is made by the levator ani and coccygeus muscles. Of the viscera of the pelvis, we can see the urinary bladder here. This is the apex of the urinary bladder, and this is the base of the urinary bladder, superior surface, and these are the inferolateral surfaces of the urinary bladder. Here, this is the ureter passing into the urinary bladder. Related to the base of the urinary bladder is the vagina, and here, this is the uterus, the fundus of the uterus and the body of the uterus here. And behind the vagina is the rectum. Above, we can see the sigmoid colon. The sigmoid colon becomes a rectum at the level of the third sacral segment, and this is the rectum here. The rectum passes through the pelvic diaphragm and becomes the anal canal. This is the uterine tube or the fallopian tube. It has a distended lateral extremity, which is called the infundibulum. It has fimbria. One of them is called the fimbria ovarica, that is connected to the ovary. Here you can see the ovary. Again, you can see the ovary on the other side here, the yellow structure, and the infundibulum. More medially, the longest part of the uterine tube is the ampulla, and this is where fertilization of the ovum takes place, and then a narrow part, which is the isthmus, and then there is an intramural portion that passes through the wall of the uterus. Also, we can see here some of the peritoneal reflections. So this is the peritoneum from the anterior abdominal wall here, and this is the peritoneum that covers the rectum. Of course, in the sigmoid colon, it has a mesentery, and where the mesentery ends, it's at the level of the third sacral segment where the rectum starts. The rectum is covered by peritoneum on its anterior surface and lateral surface, but in the middle third of the rectum, it's only covered by peritoneum on its anterior surface, and this peritoneum is reflected from the rectum onto the upper part of the vagina. This is very important to consider, that the peritoneum is reflected onto the upper part of the vagina, the region which is called the posterior fornix of the vagina. And then the peritoneum covers the uterus. So there's a pouch here, a peritoneal pouch, which is called the rectouterine pouch or the pouch of Douglas. This is a big pouch and a dependent pouch. And then the peritoneum will be reflected onto the posterior surface of the uterus, then onto the fundus of the uterus, and then returning back to the anterior surface, and then back onto the upper surface of the bladder to be continuous with the peritoneum on the anterior abdominal wall. And this will create another pouch here between the uterus and the bladder, which is called the uterovesical pouch. And this pouch, because of the usual position of the uterus of anteversion and anteflexion, it is usually a closed pouch. It is an empty pouch and a small pouch, unlike the pouch which is located posteriorly, the rectouterine pouch of Douglas, which is big and dependent pouch. And this pouch usually contains some coils of small intestine, the ileum, and the sigmoid colon. The peritoneum will be reflected laterally from the uterus to the lateral wall of the pelvis, and this double fold of peritoneum is called the broad ligament. So here is the broad ligament. You can see that in the upper free border of the broad ligament, the uterine tubes are located. Actually, the uterine tubes, they occupy the medial 3/4 of the upper free border of the broad ligament. The lateral quarter, which you can see it here, this is the lateral quarter of the upper free border of the broad ligament. It does not contain the uterine tube, and it's called the suspensory ligament of the ovary, or sometimes they call it the infundibulopelvic ligament. It contains the vessels and nerves that serve the ovary, because the ovary develops up into the posterior abdominal wall and descends down into the pelvis, like the testis, but the testis continues down into the scrotum. But here the ovary, the descent of the ovary is halted into the pelvis, so it drags its blood supply, nerve supply, and lymphatic drainage with it. So we can see here, this is the ovarian artery, the ovarian vein, together with autonomic fibers and lymphatics. They are located within this double fold of peritoneum at the upper free border of the broad ligament, which is called the infundibulopelvic ligament, or the suspensory ligament of the ovary. Within the broad ligament, we can see some of the thickenings in the broad ligament, and these are of embryonic origin. So we can see this thickening here. This is called the ligament of the ovary, or it is called sometimes the round ligament of the ovary. And here again we can see the ligament of the ovary, or the round ligament of the ovary. It connects the ovary to the uterus. Particularly it connected to the site of the cornu of the uterus, just below the entrance of the uterine tube. And this ligament is in fact continuous with another ligament that makes a thickening in the anterior leaf of the broad ligament. This one, this thickening here, this is called the round ligament of the uterus. Now the round ligament of the ovary, or ligament of the ovary, and the round ligament of the uterus are in fact, they are the remnants of the gubernaculum. The gubernaculum is a cord of fibrous tissue that is connected to the ovary on one side, and it's connected to the perineum at the site of the labia majora, or in the male at the scrotum, and it drags down the gonad, whether the ovary or the testis. In the female, because the ovary descends only down to the pelvis, does not continue its journey to the perineum, then the remains of the gubernaculum will form these thickenings, fibrous thickenings, the ligament of the ovary and the round ligament of the uterus. You can see here that the round ligament of the uterus continues toward the anterior abdominal wall to this region. This is the deep inguinal ring, okay, and then passes through the inguinal canal to appear, or to be attached to the labia majora. This is the deep inguinal ring here, and you can see here this is the inferior epigastric artery located medial to the deep inguinal ring. Now I will remove part of the model so that we can see a sagittal section of all the viscera of the pelvis. So again, this is the urinary bladder, the uterus, and the rectum. Regarding peritoneal reflections, this is the peritoneum that covers the rectum and will be reflected onto the upper part of the vagina. You can see here the vagina. This is the muscular tube of the vagina, and this is the region of the vault of the vagina, the roof of the vagina, into which protrudes the cervix of the uterus. And the cervix of the uterus is surrounded by a space, and the space here is called the fornix. The fornix, for descriptive purposes, it is divided into anterior fornix, posterior fornix, and two lateral fornices. So what we can see here in the section is the anterior fornix and the posterior fornix. The posterior fornix, as you can see, is very deep, and it is related to peritoneum. Peritoneum that forms the recto-uterine pouch, or the pouch of Douglas. This relation is very important here because you can access the peritoneal cavity by passing through the vagina, either to pass instruments or to drain an abscess. And so this is a very important peritoneal relations. Sometimes perforations here can lead to bad consequences because it results in peritonitis because of this relation of peritoneum to the posterior fornix of the vagina. Now the peritoneum will be reflected onto the posterior part of the uterus, onto the fundus of the uterus, and then the upper 2/3 of the anterior surface of the uterus, and from there it will be reflected onto the superior surface of the urinary bladder. The peritoneum is not related to the base of the urinary bladder. It's only will be reflected onto the superior surface of the urinary bladder in the female. And the pouch here, which is usually empty, as I mentioned earlier, this is called the rectovesical pouch. And then the peritoneum will continue toward the anterior abdominal wall. Here again you can see the urinary bladder. It's an empty bladder, so you can see the folds of the mucosa, and this is the region of the trigone of the urinary bladder, and from the tip of the trigone the urethra arises. The urethra in the female, as you can see, it's very short, and actually it is embedded and very closely related to the anterior wall of the vagina. Some of the details can be shown here. This is the fundus of the uterus. The fundus of the uterus is the part of the uterus that is located above the point of entry of the uterine tubes. And this is the body of the uterus. And then the cervix. The cervix starts as at an internal os. So this is the region of the internal os. And this is the cervical canal that opens as an external os. So the external os opens into the vagina, and the cervix can be seen through the vagina by a speculum examination. If we look at some of important relations, again I repeat that the upper part of the vagina posteriorly, it is related to the recto-uterine pouch, and then the middle part is related to the rectum, to the ampulla of the rectum, and the lower part of the vagina that is located below the urogenital diaphragm is related to the perineal body. This is the site of the perineal body. It's a fibrous mass that is well developed in the female, and it acts as an anchorage point. That's very important for the stability of the vagina and the uterus. Anteriorly, the vagina, the upper part of the vagina is related to the base of the urinary bladder, and the lower part of the vagina is related to the urethra. As I mentioned, that in fact the urethra is embedded within the wall of the vagina. This represents the urogenital diaphragm, these whitish structures here. You can see that the urogenital diaphragm is pierced by the urethra and the vagina. In the male, it is only pierced by the urethra, but in the female, it is pierced by the urethra and the vagina. This is the urogenital diaphragm. The urogenital diaphragm is an entity that is different from the pelvic diaphragm. The pelvic diaphragm is formed by levator ani and coccygeus muscles, but this is the urogenital diaphragm. Let me show you again the pelvic diaphragm. This is the pelvic diaphragm here, which is formed by levator ani and coccygeus muscles. This is the region of the urogenital diaphragm, and the urogenital diaphragm is triangular in shape, as you can see it here. It closes the urogenital triangle, and this is the urogenital triangle of the perineum, and the diaphragm is, as I said, it's triangular in shape. It's a little bit deficient anteriorly, inferior to the pubic symphysis. And in fact, the urogenital diaphragm is a fibromuscular structure. It's made of fibrous tissue and muscles. Let's detach the urogenital diaphragm and study it in a little bit more details. So this is the urogenital diaphragm. It is triangular in shape. And now I'm looking at the urogenital diaphragm from above, and this is looking at it from below. Here, this is the urogenital diaphragm. It's made of 2 layers of fibrous tissue. So this is the superior layer of the urogenital diaphragm, or superior fascia of the urogenital diaphragm. And here, this is the inferior fascia of the urogenital diaphragm. So these muscles here, which you can see them, they are not within the urogenital diaphragm. They are located more superficial to this layer of fascia. The urogenital diaphragm itself is bounded inferiorly by this fascia, which is the inferior fascia of the urogenital diaphragm, or it's also called the perineal membrane, and superiorly by the superior fascia of the urogenital diaphragm. And in between these 2 layers of fascia, there's a sandwich of muscle fibers. These are the muscle fibers in between. The urogenital diaphragm is pierced by the vagina and the urethra. In the male, it is only pierced by the urethra. The muscles that are located within the urogenital diaphragm are the sphincter urethrae muscle that acts as a voluntary sphincter for the urethra, and also there's another muscle here which is called the deep transverse perineal muscle. Between the superior layer of the urogenital diaphragm and the inferior layer of the urogenital diaphragm, or the perineal membrane, the space or the pouch is called the deep perineal pouch. So this is the region of the deep perineal pouch, and it contains, among other structures, it contains the sphincter urethrae and the deep transverse perineal muscle, as well as some nerves and vessels. Inferior to the perineal membrane, or the inferior fascia of the urogenital diaphragm, the space here is covered by a layer of fascia, which is an extension of the membranous layer of the fascia of the anterior abdominal wall. Here it is called the Colles fascia. It has been removed here, and so we can see the space that is located between the fascia and the inferior fascia of the urogenital diaphragm. This space that we can see it here is called the superficial perineal pouch. And within the superficial perineal pouch, we can see a lot of structures like muscles. This is the superficial transverse perineal muscle. The superficial transverse perineal muscle has a location that is superficial to the location of the deep transverse perineal muscle. The deep transverse perineal muscle is located within the deep perineal pouch, while the superficial transverse perineal muscle is located in the superficial perineal pouch. Of the other muscles that we can see here is the bulbospongiosus muscle that covers the bulb of the vestibule, and the ischiocavernosus muscle that covers the crus of the clitoris. Of the other structures that we can see in the superficial perineal pouch is the bulb of the vestibule and the greater vestibular gland, or Bartholin gland. This is a mucus gland, mucus secreting gland, and it has its duct that opens into the vestibule here. This region, which is located between the vagina and the anus, this region is the site of the perineal body. This fibromuscular mass, it's a fibrous mass to which muscle fibers are attached. So you can see here some of the muscle fibers that are attached to the perineal body. That is the superficial transverse perineal muscle. The deep transverse perineal muscle is attached to the perineal body. Bulbospongiosus muscle is also attached to the perineal body. And this muscle that forms part of the external anal sphincter, this is the superficial part of the external anal sphincter, is attached to the perineal body. The deep part of the external anal sphincter and the subcutaneous part of the external anal sphincter are not attached to the perineal body because they are circular sphincters. But this one is an ellipsoid sphincter that anteriorly it is attached to the perineal body and posteriorly it is attached to the coccyx. Also, the perineal body receives some fibers of levator ani muscle. This is the levator ani muscle. Some of its fibers are attached to the perineal body here. This is the perineal body. And you can see that here this is part of the external anal sphincter. Some fibers are attached to the perineal body as well. And this, again, I repeat that this perineal body is so important for the support of the pelvic viscera in the female, and it gets stretched and might be torn in difficult labor. Again, this is the urogenital diaphragm with a superior layer and inferior layer, superior fascia and inferior fascia of the urogenital diaphragm. And you can see here that it is a little bit deficient anteriorly and allows the transmission of a vein. This vein is the deep dorsal vein of the clitoris. This vein is larger and well developed in the male. It's formed the deep dorsal vein of the penis where it anastomoses with the prostatic venous plexus. Before dealing with the structures located in the superficial perineal pouch of the female, let's revise some of the nomenclature that is related to the external genitalia. So the whole external genitalia in the female is called the vulva, and it includes the labium majus and the labium minus. The cleft, which is located between the two labia majora, is called the pudendal cleft, and the space that is located between the two labia minora is called the vestibule. And into the vestibule, in fact, opens the vagina and the urethra. You can see here that the vagina and the urethra, they open into the vestibule, and the vestibule, again, I repeat, it is the space that is located between the two labia minora. Posteriorly, the meeting place of the two labia minora is called the frenulum of the labia minora, or the fourchette. And here, anteriorly, there is the clitoris. The clitoris is the counterpart of the male penis, but it does not contain the urethra like in the male, because the urethra, as we have seen, opens into the vestibule. So the clitoris has a similar structure of the male penis, and even it has a prepuce, which is a piece of skin that covers it. This is the prepuce of the clitoris. And inside it, it is made of cavernous tissue. This is the cavernous tissue that make the structure of the clitoris and the penis as well. It's a cavernous tissue, erectile tissue, corpus cavernosum, and its extension backwards, which is located in the superficial perineal pouch, is the crus of the clitoris, and this is the bulb of the vestibule. This cavernous tissue contains a lot of blood, and injury here might lead to bleeding within the labia majora. These cavernous erectile tissues are covered by muscle fibers. So here, this is the bulb of the vestibule. This is the bulb of the vestibule. And it is covered by muscle fibers, bulbospongiosus muscle. This is the bulbospongiosus muscle on this side, covering the bulb of the vestibule. But here the bulbospongiosus has been removed partially. And this is the crus of the clitoris. The crus of the clitoris should be located here, and it's covered by muscle fibers that form the ischiocavernosus muscle. Ischiocavernosus muscle. So bulbospongiosus, ischiocavernosus, ischiocavernosus. Note that the bulbospongiosus is attached posteriorly to the perineal body, while the ischiocavernosus muscles are not attached to the perineal body. They are located laterally and are attached to the inferior pubic ramus. Behind the bulb of the vestibule, posterior to it, is the greater vestibular gland. And this is here, you can see the greater vestibular gland. It's a mucus secreting gland that has a duct, and the duct opens into the vestibule. So the vestibule, again, it receives the opening of the urethra, the vagina, and the tiny ducts of the greater vestibular or Bartholin glands. Here we can see the two labia minora, and the vestibule is in between them. Opening into the vestibule is the opening of the urethra. So note that the urethra does not open at the clitoris, although the clitoris is a counterpart of the male penis, but it does not carry the urethra. The urethra opens here within the vestibule. This is the opening of the vagina here. And on either side of the posterior part of the labia minora is the opening of the Bartholin glands. And this is the region of the frenulum of the labia minora, or the fourchette. And this piece of skin here, this is the prepuce of the clitoris. In some cultures where female circumcision is practiced, the clitoris is removed with or without removal of labia minora. And this is to reduce the sexual arousal of the female.